East Africa, a land brimming with spectacular landscapes and exotic wildlife, the subject of movies and travelogues. But behind the postcard images, within this wealth of nature, live millions of people devastated by poverty and disease, and more than 12 million children, orphans of the AIDS epidemic. Since basic healthcare services are sporadic or non-existent, the treatment of the sick and dying and support for the orphan children are left to an overburdened community. Overlooked or forgotten by most of the world, a few of these remote villages, hours from a hospital or phone, now have the good fortune of assistance from a small international relief agency, the Lalmba Association. In 1985, with $20,000 from a letter-writing campaign, Hugh and Marty Downey founded the Lalmba Association. The word Lalmba means place of hope, and the Downeys' first project was just that, an orphanage in Eritrea that grew to house over 100 children. Today, Lalmba supports 2 additional facilities in Ethiopia and Kenya. A 9-hour drive from Nairobi on the shores of Lake Victoria is the Matoso Clinic and Angora Children's Home, the pride of Lalmba. Here a staff of 60 paid Kenyan employees are trained to work in 2 medical clinics, a mobile medical unit, and a children's home. The health clinic is community-based service providing effective and sustainable support, responding to the basic health care of families in need. The program recruits new medical volunteers to donate a year or 2 of their time to supervise and administer the program. David McClure from Littleton, New Hampshire, was program director in Matoso for the past 2 years and currently serves as the director of the Lalmba African operation.
Our primary mission here is primary medical care. Our main clinic here at Matoso sees almost 100 patients a day. Acute sick people with malaria, people with parasites, people with sexually transmitted diseases, people with AIDS, babies for vaccinations, mothers for prenatal care. Last July we opened a second dispensary at a small village 20 kilometers away, and we're treating about 40 patients a day there.
Wanda McClure, David's wife, serves as medical director of the Matoso Clinic.
Lalmba is making a huge difference to the people in this area because there are no other health services except some small government health clinics that are poorly supported with drugs and often staff. People know that we will always have medicine here. Many times when they go to the outlying health clinics, they're seen by a clinician, but then there's nothing to treat them with. As medical director, I have about 25 employees working under me. Some of those are clinicians, the people who actually see patients every day. Some are pharmacists. Some people work in the treatment room. Some people work in the laboratory. Some people work in hygiene. And some people do meds instruction. At Matoso Clinic, we see 90 to 100 patients a day. Malaria is our #1 diagnosis by far. Malaria is endemic in this area. We see it all year round. It tends to be worse during the rainy season, which is April, May, and June, but it's on our doorstep every day.
The HIV/AIDS epidemic has struck Kenya, leaving 1.5 million children orphaned and reducing adult life expectancy to 50 years of age. Many homes are empty except for children and grandparents. It is not unusual to see small children caring for even younger siblings. The children's home is down the way from the Matoso Clinic and houses 24 boys and girls ages 4 through 15 in 6 bungalows on the shores of Lake Victoria. In a warm, family-like setting, children attend school, share chores, and learn to sew and cook. The annual operating budget of $13,000 covers food, clothing, school fees, and medical treatment. Lalmba also provides a loan program for small businesses. In many cases, these are ventures started by women. In a country where tribal norms include polygamy and wife inheritance, a woman-owned business is setting an important new social standard of economic self-reliance. So tell me a little about what she does and how she...
She sells all these are foodstuffs, potatoes, maize, wheat, beans, English potatoes, onions.
I went to improve the business.
And how did the loan help you?
It helped me because nowadays I can have a variety of things to sell. This is an finger millet.
Millet?
Now this is maize.
Okay.
Now this is beans. This is cooking fat. This is maize flour.
Okay. How long have you had the business?
Now it's 5 years.
5 years. And what did you do before that?
I was just
Staying idle.
A wife?
Staying idle.
I was just a wife.
So what's it feel like to be a business person now?
Business.
You feel good?
I'm just feeling very good. I'm staying very well. Anything I would like, I can get.
You know, what we see here is our problems of poverty, of lack of economic opportunity, of poor health that are so big, affecting so many people. You know, what can Lalmba do to make a difference? You know, I feel like we are making a very positive difference in primary medical care, in orphan care. We're not changing the whole culture. We're not eliminating poverty or caring for all the orphans or curing everyone of malaria, but you know, we're helping a significant number of people. Over that corner. That's it. We can walk through the village and see babies that would have died if we hadn't transported them to the hospital. We can see orphan children that are successful in school that would be out watching the goats instead of going to school if Lalmba weren't here. You know, I can see people like that now, and I feel good about it. And I hope we can do a lot more.